I'm Dr. Michael Hayes, board-certified gastroenterologist, and I need to tell you about Margaret, a 68-year-old retired nurse from Texas who walked into my office 6 months ago looking 20 years older than her actual age. She was hunched over, moving slowly. Her skin had this gray pallor that immediately concerned me, and when she sat down in the chair across from my desk, she started crying before she even said a word. Margaret had been a nurse for 42 years. She'd spent her entire career taking care of other people, following doctors' orders without question, trusting the medical system completely, and now that same system had failed her so badly that she told me she didn't know if life was worth living anymore. Her stomach was so distended she looked 6 months pregnant. She hadn't had a solid bowel movement in 7 weeks. She was having accidents because the diarrhea would hit so suddenly she couldn't make it to the bathroom in time. She'd lost 34 pounds in 5 months. Her hair was falling out in clumps, and the constant abdominal cramping was so severe she could barely sleep more than 2 hours at a time. What broke my heart was when she pulled out a gallon-sized plastic bag filled with prescription bottles, 16 different medications, and she said her doctor kept adding more pills every time she complained about new symptoms, never once suggesting that the medications themselves might be causing her suffering. I looked through that bag and immediately identified 3 medications that I knew with absolute certainty were destroying her intestinal system from the inside out. And the tragedy is that none of them were medically necessary anymore. They'd been prescribed years ago for conditions that had either resolved or could be managed differently, but nobody had ever taken the time to reevaluate whether she still needed them. If you're over 60 and taking multiple medications, subscribe to this channel right now because what I'm about to share could prevent you from ending up in Margaret's situation. I post videos every single week specifically about protecting your digestive health as you age, and this community is built on people who want real answers, not just more prescriptions. This is educational content, not personal medical advice, so please consult your healthcare provider before changing any medications, but I'm going to explain exactly what these 3 drugs do to aging intestines and why they're prescribed so commonly, despite the devastating damage they cause in elderly patients. The first medication that was destroying Margaret's gut was a proton pump inhibitor called pantoprazole, which she'd been taking every single morning for 9 years straight. Her original doctor had prescribed it for heartburn back when she was 59, told her to take it daily, and nobody had ever suggested stopping or even reducing the dose. Here's what you need to understand about proton pump inhibitors that most doctors don't take time to explain properly. These drugs, which include omeprazole, esomeprazole, lansoprazole, pantoprazole, and rabeprazole, they don't just reduce stomach acid, they virtually eliminate it by shutting down the acid-producing pumps in your stomach lining. Now, that sounds wonderful if you have heartburn, and for short-term use, meaning 8 to 12 weeks maximum, these medications can be incredibly helpful and even necessary. But when you take them for months or years, especially after age 60 when your digestive system is already becoming more fragile, you're setting yourself up for a cascade of problems that your doctor probably never warned you about. Your stomach acid isn't just there to cause heartburn, it serves absolutely critical functions that become even more important as you get older. Stomach acid kills dangerous bacteria, viruses, and parasites that enter your body through food and water, protecting you from infections that could be life-threatening in elderly patients. It breaks down protein into amino acids that your body desperately needs to maintain muscle mass, and after 60, you're already losing muscle naturally at a rate of 3 to 8% per decade, so interfering with protein digestion accelerates this dangerous muscle loss. Stomach acid is essential for absorbing vitamin B12, which your brain and nerves need to function properly, and B12 deficiency in elderly patients causes memory problems, depression, nerve damage, and anemia that doctors often mistake for normal aging when it's actually caused by medication. It's required to absorb calcium, magnesium, and iron, minerals your bones and blood need, and deficiencies in these minerals lead to osteoporosis, fractures, heart rhythm problems, and severe fatigue. When you suppress stomach acid production for years, several catastrophic changes happen inside your digestive system. First, bacteria that should be killed in your stomach survive the journey down into your small intestine where they absolutely do not belong, multiplying out of control and causing a condition called small intestinal bacterial overgrowth, which leads to horrible bloating, excessive gas, chronic diarrhea, and malabsorption of nutrients no matter how well you eat. Second, without adequate acid, your food doesn't break down properly before moving into your intestines, so you end up with partially digested chunks of food irritating and inflaming your intestinal lining. Third, the pH change throughout your entire digestive tract disrupts the delicate balance of bacteria in your colon, killing off the beneficial species that keep you healthy while allowing dangerous bacteria like Clostridium difficile to flourish and cause severe, sometimes deadly diarrhea. Fourth, long-term PPI use damages the tight connections between the cells in your intestinal lining, creating what's called increased intestinal permeability or leaky gut, where toxins, bacteria, and undigested food particles leak through your intestinal wall into your bloodstream, triggering inflammation throughout your entire body. And fifth, research has clearly shown that elderly patients taking PPIs long-term have dramatically higher rates of microscopic colitis, a condition causing chronic watery diarrhea that's absolutely miserable to live with. Margaret had every single one of these problems when she came to see me. Her comprehensive stool test showed bacterial overgrowth, severe inflammation, almost no beneficial bacteria remaining in her gut. Her vitamin B12 level was dangerously low at 187, which explained the numbness and tingling in her feet that another doctor had diagnosed as diabetic neuropathy, even though she wasn't diabetic. And her bone density scan showed osteoporosis that had developed rapidly over the past 3 years as the PPI prevented calcium absorption. The second medication poisoning Margaret's intestines was meloxicam, a prescription-strength, non-steroidal anti-inflammatory drug that she took every single day for arthritis in her knees and hands. She'd been taking 15 milligrams daily for 6 years, and while it did help her joint pain somewhat, nobody had ever explained to her what it was doing to her digestive system every single time she swallowed that pill. Non-steroidal anti-inflammatory drugs, which include ibuprofen, naproxen, diclofenac, meloxicam, and many others. They work by blocking enzymes called COX-1 and COX-2 that produce chemicals called prostaglandins, which cause inflammation and pain. Blocking these enzymes reduces your discomfort, which is why these drugs are prescribed so frequently to older adults who suffer from chronic pain. But here's the critical part that doesn't get explained. Those same prostaglandins that cause inflammation also maintain the protective mucus layer coating your stomach and intestines. They ensure adequate blood flow to your gut lining, and they promote rapid repair of the microscopic damage that naturally occurs in your digestive tract every single day. When you block prostaglandin production with an NSAID, you're stripping away the very mechanisms your intestines need to stay healthy and heal themselves. In younger people, the body can sometimes compensate for this, but in patients over 60, the damage accumulates much faster because your intestinal lining is already more fragile. Your blood flow to the gut naturally decreases with age, and your repair mechanisms slow down significantly. What happens is that NSAIDs cause damage throughout your entire digestive tract, not just your stomach, creating ulcers, erosions, bleeding, increased permeability, and in severe cases, strictures where your intestine narrows from chronic inflammation and scarring, or even perforation where a hole develops requiring emergency surgery. The truly frightening part is that up to 70% of elderly patients taking NSAIDs regularly have significant intestinal damage visible on endoscopy, even when they have no symptoms whatsoever. The damage is happening silently, destroying your gut day after day, until suddenly one day you start bleeding internally and end up in the emergency room. Margaret's iron level was critically low at 23. She was severely anemic, and when I performed a colonoscopy and upper endoscopy on her, I found multiple ulcers in her small intestine that were bleeding slowly but steadily. She'd been losing blood for months without realizing it, and the meloxicam was the direct cause. Comment below if you're currently taking any pain medications daily. I need to know what you're dealing with so I can create content that addresses your specific situation. And I read every single comment personally. The third medication that had devastated Margaret's digestive system was actually a series of antibiotics she'd been prescribed repeatedly over the past 4 years, specifically ciprofloxacin for recurrent urinary tract infections. She'd taken 11 courses of this powerful broad-spectrum antibiotic, each course lasting 7 to 10 days, and nobody had ever discussed with her what this was doing to her gut bacteria or offered her any strategies to protect her intestinal health during and after antibiotic treatment. Every time you take a course of antibiotics, you're essentially dropping a nuclear bomb on your intestinal microbiome, killing not only the harmful bacteria causing your infection, but also destroying billions of beneficial bacteria that are absolutely essential for your digestive health, immune function, nutrient production, and overall well-being. In younger people, the gut microbiome typically recovers reasonably well after a single course of antibiotics, although it may take several months to fully restore bacterial diversity. But in people over 60, the recovery is much slower, far less complete, and after multiple courses of antibiotics, especially powerful fluoroquinolones like ciprofloxacin, the damage can become permanent. Research has demonstrated that elderly patients who take multiple courses of antibiotics over several years end up with profoundly altered gut bacteria populations, dramatically reduced diversity of beneficial bacterial species, loss of keystone species that help maintain gut health, and dangerous overgrowth of harmful resistant organisms that cause ongoing problems. This creates a cascade of serious health issues. First, repeated antibiotic use massively increases your risk of Clostridium difficile infection, a dangerous bacteria that causes severe watery diarrhea, intense abdominal cramping, fever, dehydration, and in elderly patients can be fatal, with death rates as high as 15 to 20% in those over 65. And once you've had C. diff infection, you're at very high risk of getting it again and again. Second, destruction of beneficial gut bacteria severely impairs your immune system because approximately 70% of your immune cells live in and around your intestinal lining, and they depend on signals from healthy gut bacteria to function properly. So after multiple courses of antibiotics, you become more susceptible to all kinds of infections, creating a vicious cycle where you need more antibiotics, which further destroys your gut bacteria, which weakens your immune system more. Third, loss of bacterial diversity leads to chronic low-grade inflammation throughout your intestines and your entire body, contributing to accelerated aging and increased risk of heart disease, diabetes, cancer, Alzheimer's disease, and countless other conditions. Fourth, beneficial bacteria produce short-chain fatty acids, especially butyrate, that directly feed and heal your intestinal lining cells, and when antibiotics kill these bacteria, your gut lining becomes weaker, more permeable, and more susceptible to damage. And fifth, your gut bacteria actually manufacture certain vitamins, including vitamin K and several B vitamins. So when antibiotics wipe them out, you become deficient in these essential nutrients even if your diet is perfect. Margaret's comprehensive stool analysis showed that her gut bacterial diversity was absolutely devastated. She had almost no beneficial lactobacillus or bifidobacterium species remaining. Her levels of inflammation markers were sky high, and she tested positive for Clostridium difficile toxin, which explained the explosive watery diarrhea and severe cramping she'd been experiencing. She was trapped in a nightmare cycle. She'd get a UTI, take ciprofloxacin, develop C. diff diarrhea, take vancomycin to treat the C. diff, feel better for a few weeks, then get another UTI because her immune system was so compromised, take more Cipro, get C. diff again, and the cycle continued destroying her gut more with each round. Now, you might be wondering why doctors prescribe these 3 types of medications so freely to elderly patients if they cause such severe damage. It's a question I ask myself constantly, and the answer is complex and honestly quite frustrating. First, these medications do provide real short-term benefits. They reduce pain, they control acid reflux, they kill infections, and in our fast-paced healthcare system, prescribing a pill that provides quick symptom relief is much faster and easier than investigating root causes or implementing lifestyle changes that take time and effort. Second, many primary care doctors simply aren't aware of the extent of intestinal damage these drugs cause in elderly patients because they don't perform endoscopies and colonoscopies. They don't see the ulcers, the inflammation, the bacterial devastation. They only hear about symptoms. And when patients develop new symptoms from medication side effects, the instinct is often to prescribe another medication to treat those new symptoms rather than questioning whether the original medications might be the problem. Third, pharmaceutical companies have spent literally billions of dollars marketing these drugs as safe and effective, downplaying the serious long-term risks, especially in vulnerable elderly populations. And many doctors base their prescribing habits on this marketing rather than diving deep into the independent research. Fourth, patients themselves often demand these medications because they provide immediate relief and nobody wants to suffer with pain or heartburn or infections. So there's pressure on doctors to prescribe what patients expect. And fifth, our entire healthcare system is designed to treat symptoms quickly rather than address underlying causes. So we've created a culture where taking multiple medications is considered normal and even expected as you age, when in reality, the more medications you take, especially these three categories, the sicker you're likely to become. Here's what I did for Margaret, and I'm sharing this not as a prescription for you, but as an example of what's possible when you work with a knowledgeable doctor who's willing to take the time to address root causes rather than just piling on more medications. First, we created a careful plan to wean her off the pantoprazole. I didn't just stop it abruptly because that can cause severe rebound acid hypersecretion. Instead, we reduced the dose gradually over 6 weeks while simultaneously implementing dietary changes, including eliminating trigger foods like coffee, chocolate, alcohol, and spicy foods, eating smaller meals, not eating within 3 hours of bedtime, elevating the head of her bed 6 inches, and adding specific supplements including deglycyrrhizinated licorice and zinc carnosine that help heal and protect the esophageal and stomach lining. Second, we stopped the meloxicam completely and replaced it with a comprehensive pain management plan that included acetaminophen, which doesn't damage the gut, topical diclofenac gel applied directly to painful joints, which provides relief without the systemic intestinal damage, physical therapy focused on gentle strengthening exercises, twice-weekly warm water aquatic therapy that reduced joint stress while maintaining mobility, daily gentle stretching, heat therapy using warm packs, and a high-quality curcumin supplement that has natural anti-inflammatory properties without the gut-damaging effects of NSAIDs. Third, we treated her active C. diff infection with a proper course of vancomycin, followed by a 6-week course of a specific probiotic yeast called Saccharomyces boulardii that helps prevent C. diff recurrence. Then we began a comprehensive gut restoration protocol, including multiple strains of beneficial bacteria, prebiotic fiber to feed the good bacteria, and fermented foods like yogurt, kefir, and sauerkraut to introduce diverse beneficial organisms. Fourth, we worked with her urologist to figure out why she kept getting UTIs in the first place, and we discovered she had incomplete bladder emptying and mild prolapse. So we implemented a bladder training program, taught her proper wiping technique, increased her water intake significantly, started her on a low-dose vaginal estrogen cream that helps restore the protective bacteria in the urogenital area, and added a daily cranberry supplement and D-mannose powder that help prevent bacteria from adhering to the bladder wall, all of which dramatically reduced her UTI frequency without needing constant antibiotics. And fifth, we addressed her nutritional deficiencies with vitamin B12 injections initially, then sublingual tablets, iron supplementation to rebuild her blood, calcium and vitamin D for her bones, magnesium for muscle and nerve function, and zinc for immune support and gut healing. Share this video with anyone you know over 60 who takes multiple medications, because this information could literally save their life, or at least save them from years of unnecessary suffering that could be prevented. The transformation I saw in Margaret over the following 6 months was honestly one of the most rewarding experiences of my career. Within 2 weeks of starting the protocol, her bowel movements began normalizing, the explosive diarrhea stopped, and she could actually leave her house without panic about finding a bathroom. Within 4 weeks, her bloating had reduced by about 60%. She was sleeping better because the cramping had decreased significantly, and she had enough energy to start doing light household chores again. By 8 weeks, her skin color had improved. She was smiling and laughing during our appointments. She'd gained back 7 pounds of healthy weight, and she told me she felt hopeful for the first time in 2 years. At the 6-month mark, her follow-up stool test showed her gut bacteria diversity had improved dramatically. Her inflammation markers had dropped into the normal range. Her vitamin and mineral levels were all optimal. Her bone density scan showed she'd stopped losing bone mass. And when I repeated her endoscopy and colonoscopy, the ulcers had completely healed and her intestinal lining looked healthier than I ever thought possible. She'd gained back 18 pounds, her hair had stopped falling out and was actually growing back thicker. She had consistent daily bowel movements without pain or urgency. She was sleeping 7 to 8 hours every night. Her arthritis pain was well controlled without NSAIDs, and she hadn't had a single urinary tract infection in 6 months. Margaret told me she felt like she had her life back, and she was angry that she'd suffered unnecessarily for so long when the solution was removing the medications that were poisoning her rather than adding more pills. Now, I want to be extremely clear about something important. I am not suggesting that you stop any prescribed medications without proper medical supervision. Suddenly, discontinuing certain medications can cause serious rebound effects, withdrawal symptoms, or worsening of your original condition. What I am telling you is that if you're over 60 and you're taking any of these 3 categories of medications, proton pump inhibitors for acid reflux, NSAIDs for pain, or frequent courses of antibiotics, you need to have a serious conversation with your doctor about whether these medications are still necessary, whether the benefits truly outweigh the risks at this point in your life, and whether there are safer alternatives that could be equally effective without destroying your gut. If your doctor dismisses your concerns or refuses to consider alternatives, it may be time to seek a second opinion from a gastroenterologist or a physician who specializes in geriatric medicine and understands the unique vulnerabilities of the aging digestive system. Here's exactly what you should do starting today. First, make a complete list of every medication you're taking, including prescription drugs, over-the-counter medications, and supplements. Write down the dose of each one, how long you've been taking it, and what condition it was originally prescribed for. Second, schedule a dedicated medication review appointment with your doctor, not just a regular checkup where medications are discussed briefly, but a full appointment focused specifically on evaluating whether each medication is still necessary and whether safer alternatives exist. Third, bring a list of questions to that appointment including, do I still need this medication, or has my condition changed? What are the long-term risks of continuing this medication at my age? Are there safer alternatives we could try? Could any of my current symptoms be caused by my medications rather than new health problems? Fourth, for proton pump inhibitors specifically, ask your doctor about implementing a step-down protocol where you gradually reduce the dose over several weeks while making lifestyle modifications like dietary changes, eating smaller meals, avoiding trigger foods, not lying down for 3 hours after eating, elevating the head of your bed, losing weight if needed, and managing stress, and discuss whether switching to an H2 blocker like famotidine might be appropriate as a bridge medication. Thank you for watching all the way to the end. The fact that you stayed with me through this entire video tells me you're serious about protecting your health, and you're not just looking for quick fixes. You want real solutions based on science and clinical experience. Individual results vary, and this information is meant to complement professional medical care, not replace it. So please work closely with your own healthcare team, but use this information to ask better questions and advocate for yourself, because nobody will care more about your health than you do. Take care of your gut because it's working hard every single day to take care of you, and you deserve to feel strong, energetic, and comfortable in these important years of your life.